KEYNOTE-355 was a randomized phase 3 trial designed to evaluate the efficacy of adding pembrolizumab to chemotherapy in patients with metastatic triple-negative breast cancer in the first-line setting. Patients were eligible who had relapsed at least 6 months after receiving their last treatment in the curative or early stage setting. Patients in this trial were randomized 2-to-1 to receive pembrolizumab or placebo with a menu of chemotherapy, including paclitaxel, nab-paclitaxel, or gemcitabine and carboplatin. 847 patients were randomized 2-to-1 in this trial, and 38% of patients had PD-L1 positive disease defined as a CPS of 10 or greater. Interestingly, 75% of patients were PD-L1 positive with a CPS of 1 or greater. We have previously presented and published the data from with PFS, demonstrating a statistically significant improvement in PFS with an absolute improvement of 4.1 months. At this presentation, we demonstrated a significant improvement in overall survival in patients who had PD-L1 CPS of 10 or greater metastatic triple-negative breast cancer, going from 16.1 to 23 months with a hazard ratio of 0.73 and a p-value of 0.0093. In the 75% of patients who had a CPS of 1 or greater, there also was a small numerical improvement in overall survival of just 1.6 months. This p-value was 0.0563. It is not statistically significant. We also looked at key secondary endpoints, including overall response, disease control rate, and duration of response, all of which were significantly improved in patients receiving pembrolizumab. In particular, the duration of response was over 1 year in patients receiving pembro versus 7 months in those receiving placebo, and at 1 year, there was a marked difference in duration of response in patients receiving pembro. In summary, KEYNOTE-355 demonstrated a significant improvement in progression-free survival and overall survival with the addition of pembrolizumab to chemotherapy versus chemotherapy alone as first-line treatment for PD-L1 positive metastatic triple-negative breast cancer when PD-L1 positivity is defined as a CPS of 10 or greater. This difference is clinically meaningful and supports the addition of pembrolizumab to chemotherapy in patients with PD-L1 positive metastatic triple-negative breast cancer as a new standard of care. In particular, the toxicity was consistent with the known safety profiles of the regimens and is manageable, along with key identification of these toxicities and early management.